As our ASH 15 coverage continues here in Orlando, we're happy to have back with us Dr. Shyamala Navada from the Mount Sinai Hospital in New York City. Nice to see you again.
Nice to see you too.
So you've been busy. Let's talk about this phase 2 study, the combination of oral Rigosertib and Azacitidine in patients with MDS. What was the rationale for using this combination in the study?
We used the combination of oral Rigosertib and Azacitidine based off of preclinical work. In vitro, we saw that the combination was synergistic in cell lines, and the synergy was seen when the Rigosertib preceded the Azacitidine. Based off of that preclinical work, we decided to design this clinical trial to test the combination in patients.
What was the design of this study?
So in the phase 1 part of the study, we used escalating doses of oral Rigosertib and standard dose Azacitidine on patients with MDS, CMML, and AML. But the focus of our presentation this time is on the phase 2 results. And the phase 2 study was limited to MDS and CMML only. Based off of the phase 1, we found the recommended phase 2 dose of Rigosertib, an oral agent, of 560 milligrams in the morning and 280 milligrams at night, and standard dose Azacitidine. And that was the dose that all patients received in the phase 2 study. And they received repetitive courses of the agents for their disease.
What stands out as significant to you in what you've discovered?
We found that the combination of the two agents was well tolerated, and that the addition of Rigosertib did not increase Azacitidine toxicity, which was an important finding. We also found overall response rates in 77% of patients. Perhaps what was most compelling is that 64% of the patients that we treated that received prior hypomethylating therapy responded to the combination, whether it was complete response, marrow response, or hematologic improvement. This population of patients who do not respond to a hypomethylating agent have a poor prognosis, typically in the range of 4 to 6 months. And there's no standard therapies for this patient population. So to have a combination that could potentially overcome this resistance is an important finding.
How strong is this potential, do you think?
I think it's a very important observation and a novel observation in that right now there are no standard therapies for this population, and there are ongoing clinical trials looking for agents to use for these patients, but to find that we can potentially overcome azacitidine resistance is a very important observation.
Safe to say you're building hope.
Yes.
So where do you go next?
So moving forward, we have to see how we want to design our next trial. Some options that we have been considering are to look at de novo MDS patients and test azacitidine plus Rigosertib versus standard dose azacitidine. I think another potential option would be to look at the hypomethylating failures and to test the combination in a randomized trial compared to best supportive care or physician's choice to see if the combination proves to be superior to other combinations or other agents.
Very good. Nice to see you again.
Nice to see you
Keep us
too.
posted. Come back and see us again, okay?
Thank you.
Okay.